Hi everybody, I'm very happy today to have John-Barry Waldron who's joined us. He's kindly offered to give viewers some key interview advice for any of you applying for mental health jobs. Quite a few of you have asked for this session as a newly registered mental health nurse or an early career mental health nurse. John's going to go over what employers are looking for, how to prepare for key interview questions, along with some top tips for interviews. John currently works as a ward manager in a mental health hospital and he conducts interviews as part of his role. And he also runs a podcast called On the Ward, which I highly recommend. It's a really fantastic podcast where John shares patients' journeys in a secure mental health hospital. So welcome, John. Thank you for coming today.
Oh, no, thanks for having me, Carol. I'm very pleased to be here. Very happy to help.
Thank you. So I thought the first thing would be quite good to go through, John, is just to talk through some of the range of roles that early career nurses can apply for.
Well, I suppose that's the only benefit at the moment of having such a shortage of nurses across the UK is that there is plenty of jobs in all sorts of roles. So there's loads of different places that people can go and work now. So we can work in hospitals or the community, doctors' surgeries, schools, some research nursing. There's so many vast and very different roles that people can apply for. I think that's one of the only benefits at the moment, that we're so short that there will be a job anywhere.
Yeah. And what do you think about because quite often you get people telling early career nurses that they should start in a hospital rather than community. So what would you advise when people say that?
I heard that as well when I was nursing, that you better go to the hospitals first and get your experience and then go to the community. But I think that's a very old-fashioned way of thinking. I think what we're trying to do in mental health nursing now is expand it out and really try and push early intervention, and that's in the community. And there is no reason why people can't go straight to the community or go straight into, working in research nursing or go in working in a GP surgery or in a school. We're trying to get early intervention and get people to learn and use their mental health better. And I think going back to hospitals, going into hospitals is kind of an old-fashioned way of doing it. That's not to say you shouldn't go into hospitals, because they're also very useful and very great environments to learn too.
Yeah, absolutely. So what are some of your, just give me some of your top tips to start with. Let's start with some top tips.
Well, I'd say the first one is you be confident, because when you're going in, it's not just them interviewing you, you're interviewing them too. And because there's such a shortage, if you're a good, decent nurse or decent student, they want you. So try and be confident. I know it's very hard because obviously it's very nerve-wracking doing interviews, but don't be worried about doing many interviews. So you can go for an interview and decide, actually, I don't want to work in this place, and you can still go and interview in somewhere else. There's a lot of pressure now on students to already pick their placement or where they're going to work before they finish university. So I would say take your time, find somewhere that you like, research the place you want to work, and be confident. Yeah, because people are really desperate for really good nurses.
Brilliant, some really good advice there. And one thing I often do with adult nursing interviews is ask people to prepare, look at some background research. And obviously you're mental health nurse, you've got much more specific knowledge for mental health. So what would be your advice for background research for interviews? For mental health nurses specifically.
Yeah, as we said before, because it's so varied, where you're going to do your interview will be a really specific place. So you could be working in inpatient setting, but even within the inpatient setting, there's lots of different versions of nursing. So you could be working with older adults, you could be working in secure services, you could be working with eating disorder patients. So it's really important that you know the place you're going to interview. And it doesn't take much time just to research a little bit on the background of where you're going to work. Now, you don't have to, Google and find out when the building was made and all that kind of stuff, but you do need to know what type of patients you're going to be working with. That's kind of a bugbear of mine, is when I do interviews and I ask the interviewer, I say, well, what's the client group that we have here? And if they don't know, that's a bit worrying, because I think, why have they applied for this job? Does that make sense? So it doesn't take much, just a little bit of research, real background research, Google where you're going to work. And a lot of places will allow you to come and walk around. So there's no harm in going and have a look around the hospital, have a look at the setting. As I said before, right at the very start, you're interviewing them as well as them interviewing you. So it's always good to have a look around and get kind of a vibe for the place.
Yeah, and informal, because I know years ago we were expected to do informal visits, and a lot of students worry about, how do I do it? What is an informal visit? So do you want to just sort of say what an informal visit is and how you would arrange one?
So
because that'd be helpful for students.
Yeah. I mean, I've had it. I did it in my current workplace. Is literally ring them up and say, like, I'm applying for a job here. I've got an interview. I'd really like to come and just look around the hospital. Now, ordinarily it'll be a nurse or someone else will come and just show you the ward setting and maybe some of the patients and things like that. But it's more of an informal visit, because you're not working, and it's your like it's hard to describe, but basically you do get vibes. You know, if you walk around somewhere, you can kind of see the environment, and obviously you can see some of what's going on. And I would definitely advocate doing that if you can. I mean, some places you can't; it's not going to be possible, but a lot of places you can.
Yeah, because the point you're making is it's about your needs as well, isn't it? And you, like you said, you do get a vibe. You do get, you know, can I work with this team? You know, the whole ethos is the place, and you'll get that team approach and stuff. And what about things like, do you still, because I know with our students, a lot of them get asked about the 6 C's. Do you get that in mental health as well, or not?
Completely. Yeah, six C's are really important. So that would probably come up in an interview, and even if it doesn't, it's always good to have it, just to know what the 6 C's are, and probably try and think of examples of how you've used them.
Yeah.
So particularly like compassion is a big one. So particularly in mental health nursing, we want to know why the nurses or how the nurses are compassionate, and maybe have some examples of how you've been compassionate, perhaps in placement. I mean, some people work as HCAs, but whatever, but some concrete examples of how you've used your compassion in the workplace. Brilliant. Or in your student life.
Yeah, and we also often will tell our students to look at sort of standards or any policies or guidelines. So with mental health, would you suggest that they revise the Mental Health Act, for example, or sectioning, anything like that, as well as background for information before the interview?
Yes, I'd say that's kind of a must, really, is to learn about the different forms of section. Even if you're working in the community, it may be at some point that you may have patients that are on section or have been on section previously. So it's really important just to learn, and you don't have to go really in depth. I think Mind have a really kind of good generic basic website that you can look, and it just lists all the different sections, and it just lists what they do and why we have them. And it's really good to research that just before you go in, so you know yourself. So the interviewer doesn't catch you out and say, well, we have lots of patients here on section 37. What's the section 37? And people might get caught up and they might get flustered. The other thing as well to say is obviously do your research if you can. But if you don't know the answer, my stock answer would be like, just tell them, just say, I'm not sure on that, but that's why I'm here. I want to learn and I want to find out what the answer to that question is. There's no problem with not knowing.
Yeah.
It's showing that you want to learn. That's really important for an interviewer as well.
Yeah, and that you're safe, isn't it? So that if it was a question about something that needed escalating, that you'd adhere to the escalation and be safe, a safe practitioner, isn't it? So so we said 6 C's, Mental Health Act, section.
Mental Health Act essential, yes.
Yeah, co-production as well. Do you because I hear about co-production a lot with mental health as well. Is that a good area to look at?
Definitely. So that's a big thing now in mental health nursing, is slightly different to general nursing. Mental health nursing, you're really working with a patient, right? So the patient is your helper, right? So you're not going to be able to do much if the patient doesn't go along the journey with you. So co-production is all about how are you going to work with that patient to help make them better. So, you know, there's lots of different ways you can do that. Like on the wards, we sometimes have community meetings where we all get together and we have discussions about how we can improve the ward. But in terms of your patient, specifically writing care plans together, researching together, what works for them. So every patient is going to be different. And the idea of co-production is how are you going to work together to help the patient. Really important in mental health nursing.
Yeah, yeah. And that's sort of what your podcast is about as well, isn't it? It's great to gain some insights from your podcast, maybe that some students might not have worked in certain areas. So I don't know if you want to talk a bit about that, or... That's
a great plug, Carol. Thank you very much. Slip your fiver for that. But yeah, if you get a chance, I mean, the On the Ward podcast. So basically, it was done with the patients. So the idea is to get them to talk about their story and their journey. And I think it is really useful for people to hear it, particularly if you're going to work in secure hospital, because it kind of gives a broad overview of what it's like to be a patient in a secure hospital. And I think that's the idea of co-production, is that you're really working with the patient and involving them in the care. I mean, they always say, what the phrase is, nothing about me without me. So essentially if you're doing something to the patient, they really should be involved, and you should be really encouraging them to be involved in the care. So particularly in mental health nursing, that's probably going to come up in an interview about how you're going to involve your patient in their nursing care.
Yeah. Brilliant. Some fantastic advice from you, John. So can we just think about some questions, because that's the first thing, you know, people want to know the types of questions. So there's going to be generic questions, isn't there? So for any interview you go for, you're going to get asked it might be worded differently, but why you've applied for this role, or what led you to apply for this specialist role. So some key tips for preparing for that, that question.
Like we said at the start, so research is very important. So what is this place you're applying for? That's one thing.
Yeah.
And then why have you specifically applied for this place? So if it is a secure service, why do you want to work for secure patients? Maybe you want to work for patients that are severely unwell, that are really, needing care, kind of emergency kind of treatment. Or maybe you're working in the community because you want to be at that front line and doing more therapy kind of stuff. But really, you've got to know why you're choosing this particular role. And that's hard for people because sometimes they apply and they're not sure themselves. We get an awful lot of students who apply and they just said, look, I had a placement here, it seemed nice, so I'm going to apply here.
Yeah. And
which is fine.
Okay to say, isn't
that's
it?
okay. Of course. Yeah, of course. I experienced working here and I liked it. I enjoyed it. But then you've just got to really focus on why did you enjoy it? What was the difference here to some of the other placements you had?
Yeah.
And I don't think it's good enough to just say, well, all the other places were crap and this place was all right.
Yeah.
You've got to be a bit specific about why you want to work there.
Yeah, and it's knowing about it. I mean, I suppose one thing some students might say is, I want to try it because I've never tried it. So they don't really know about the area, but you've looked into what you're saying is you need to look into the area. So, that if you're going to try something completely different to, that you've never tried before, that you still know about what you're applying for, is essentially what you say. But it's okay to say that you've never worked there, isn't it?
Yeah. Oh, 100%. Yeah, again, you've had lots of nurses have no experience of where they're working, but they want to go and try it because they've researched it. That's the key. They found out why they want to work there. They found out that this appeals to them and they want to go and try it out. And that's fine as well. That's definitely a plus point if they know they want to do it, but why do they want to do it? So that's top tip. Just find out what the place is and why you want to work there.
Yeah. And then I've got a second question that we ask a lot in adult nursing. I don't know if you do, but tell me a bit about your degree. What did you enjoy, or what did you, and so any tips if you get asked about your sort of degree and your course?
I know with mental health nursing interviews, generally we want to ask about examples. So what have you done in your course that you're going to bring to the workplace? So that might be you've done some sort of learning about therapy, so CBT or DBT, and the service you're going to provides DBT, and that'd be really interesting to talk about. Well, how do you think you're going to bring that knowledge to the patient group? Same with if you did a lot of stuff about working in teams, and how did that appeal to you, and how did you lead your team? Because as a nurse, you're going to have to kind of lead HCAs, and just basically we want specific concrete examples of how you're going to transpose what you've learned into the workplace. Yeah.
Amazing. And that's so important, isn't it? And to have those examples, because it's quite difficult to pluck them out of the air when you're nervous in an interview, and to think about, and one example might cover lots of areas, and I mean the sort of areas I've got down is sort of compassion, quality. This is what we ask in adults. I mean, obviously this is why I'm asking for your expert knowledge, but compassion, quality care, and teamwork, or how you overcame a challenge in some way. Are they the sort of areas, or would you look at other areas that you
they're very similar. Those things you mentioned all transpose to mental health nursing as well, but as I said, you can kind of drill down a little bit into more specifics about so you're working with patient groups that might be difficult and challenging, so how did you deal with difficult and challenging things in the past, and how did you overcome some of the challenges, and how did you deal with patients that may be perhaps aggressive or hostile, and how do you cope with that, and how do you deal with that, or patients that don't want to engage, how do you make patients engage or try and encourage them to engage a bit more? And I'm sure like in everybody's degrees, I'm sure there was loads of stuff that there's probably some module that they preferred much more than the rest. Yeah. And I would go with that. Anything that you like and you enjoyed, bring that to the interview and say, like, look, I learned about patients with eating disorder. I'm really fascinated about how to help patients like that, and I realized that they're a really high risk group, and that's why I wanted to help them. So anything that you enjoyed and you like doing in your degree and you've got a passion for, I would say definitely bring it up in the interview, because that's what comes across is when you're talking about something you enjoy, that really helps, and it really helps the interviewer to know why does this person want to get this job.
Yeah, so brilliant tips there, John. So I thought if we just move on to scenario type questions. So I'm not sure the sort of scenario, but we have a lot on medication, escalation, safety, safeguarding, or sort of scenario based questions linked to a specific field. So if they went for oncology or end of life care, it would be a scenario based question linked to that. So could you give any advice on some example scenario? Now, and we need to make it clear that these don't always come up. Obviously you could be asked something completely different, but it should be linked to your job description, the role that you're applying for. So John's gives some fantastic tips about informal visits, looking into the role, looking into those standards, background information. But what sort of scenario-based questions, John?
So, I mean, as you said, unfortunately, you can't say exactly what's going to come up, but some of these questions might come up in different kind of ways. But one that might be specific to mental health would be, you have a patient who's declining their medication. What do you do in that scenario? So we often get patients, because of their mental illness or because of, for various different reasons, they've started declining their mental health medication. What would you do in this scenario? And that's across the board. So if you're working in the community or you're working in a hospital-based setting, in either place, how would you manage a patient that has decided they're not going to take their medication? What do you do?
Yeah. And then what about suicidal ideation or self-harm? Do you ever get questions on that?
Again, that would be another one. Yeah. So probably risk assessment would come up. So in mental health nursing, a lot of the stuff we do is based around risk and risk assessment. So I'd learn and research a bit about risk assessment, what it means and why do we do it. But you're right, specifically about patients that may have suicidal thoughts, suicidal ideation, patients that self-harm. We have, unfortunately, a lot of patients who self-harm, both in the community and in patient setting. And what you're going to do to kind of mitigate them risks, and how do you cope with patients that are doing that kind of behaviours?
Yeah, and I hope, because I'm not a mental health nurse, I don't want to say the wrong terms either, because I get worried I was going to say the wrong terms. Is suicidal ideation the right term that I'm using, or?
Yeah. I mean, like, I think sometimes people can get caught up a little bit in the description of what people mean, and I think I always try and say that. Well, I mean, this is not an interview for the interviewing tip, but it's just for a general tip. Is always ask the patients, right? So always ask the patients about what term do they like using, or what term do they prefer to use. And if a patient says, "Oh, I really don't like it when you say that," well, then obviously use a different term. If a patient doesn't mind, then that's okay,
Yeah, because with addictions now, we call, what's the right terms with addictions? I've forgotten.
I think I still use addictions. I
got told somebody was saying the other day about using a different term, but anyway.
I don't know. In my service, we still use addiction at the moment.
Yeah, it's interesting because there's so many terms. You don't want to offend people, but there's so many different terms, isn't there, as well? But I think you're right to be patient focused.
Yes, and a good one to research. If you get a chance, is it may come up into, I don't know, depending on your specific area, but is personality disorder. So that's a loaded term that's become really kind of controversial at the moment, and patients sometimes like it, sometimes don't like it. So that's a good one to kind of research a little bit the background, because there is an awful lot of patients with personality disorder traits in the community, but why would that be? Why would patients not want to use that term? And sort of your background in researching a little bit about personality disorder and the kind of features that sometimes presents.
Yeah, that's some really good tips there, John. So another area, John, that we have a lot is to do with coping with stress, managing stress, knowing when you're getting stressed. And you see a lot of sort of trauma at work as well as a mental health nurse, don't you? So is that a sort of question that might come up as well?
I would say, as we said before, you can't definitely say what's going to come up.
No.
But I would say 99% this one's going to come up, because it is a very stressful job. So whatever setting you work in mental health nursing, there is going to be a lot of stress. I mean, that's just unfortunate as part of the job. But it's how do you cope with that stress? And I would say on nearly every interview I've ever done or I've ever had, they've always asked about how do you cope with stress, because it is a very stressful environment. And so it is going to affect you at some point, and what methods can you use to kind of cope with that stress that you're going to probably experience at work?
And then another one as well is overcoming a challenge, and that could be something, if you're a student, it could be something to do with your coursework, couldn't it, or something that you found difficult that you've overcome. But if they are something like overcoming a challenge, you want to sort of give those strategies that you use sometimes. It's sort of, would you say, is that
I would agree with you that that's another thing that we're going to get in the workplace as well. Unfortunately, not every workplace is fantastic all the time. There are going to be challenges, and there's going to be things you're going to have to cope with, and using the stress is kind of part of it, or kind of de-stressing, but also another part of it is how you're going to overcome that challenge, like you said. So it's going to be maybe a colleague that you're not getting on with, or maybe a patient you find particularly difficult. What do you do to kind of meet them challenges? I mean, obviously in my workplace we have like clinical supervision, very hot topic, and really good to bring it up if you can. About what do we have as well? Reflective practice. So that's an opportunity for people to discuss patients and particularly different areas of work. So so try and use them kind of things that in the workplace that you're going to use to cope. Obviously, it is important that you try to explain stuff that you do outside of work. So I don't know, yoga or whatever, that's good as well. But sometimes they're looking for stuff that you do in work. So what can you do in the workplace to help with your stress and cope with kind of some of the challenges that we meet.
Yeah, and the main thing is talking to someone, isn't it, John? That you don't hold it in and then make yourself ill and not talk to people. So sort of knowing about the structures, like we have. Do you have freedom to speak up, guardians in mental health as well? Or?
We do, yes. We have them kind of things. We have obviously, you know, whistleblowing if you're concerned about things, and we have staff kind of well-being telephone lines and things that you can ring. So there's lots of avenues, and I would definitely say to people, use them. You know, that's what they're there for.
Yeah, brilliant. So one thing, so that's sort of the generic-y type questions. I don't know if there's any other generic questions, but they're sort of some that I could think of that were sort of quite general. So the other thing, sorry, go on, John.
No, I was going to say, like, the bulk of the stuff is there, but they're going to throw some curveballs at you. That's the other thing I would say. Try and be aware that there are going to be questions in there that you go, well, where did that come from? But as I said before, the big thing is just say, I'm not sure. It's okay to say you don't know the answer to the question, and then just say, I'm going to research that when I get in the job. And the reason I chose this job is because I want to learn about the things you're asking me. So there's no shame or no worry in saying that you don't know. But I think when you try and fumble through and you maybe get the wrong answer, that's when it becomes, you know, but that's almost worse than just saying, I'm not sure.
Yeah. And the other thing is, I suppose, is don't be afraid to ask them to reframe the question. So I've been on interview panels where somebody's quite junior interviewing and they've put two or three, as you more with senior posts really, but they might put two questions in together, and I'm thinking that's confusing me, let alone the person being interviewed. But if you're not quite sure what somebody means, there's nothing wrong with saying, oh, do you mean this, or could you just explain that a bit, you know, would you say that's I
would absolutely agree, and you're right about the interviewer being nervous as well. You know, when I'm interviewing people as well, I want them to do well. You know, I don't want to catch people out and make people look silly. I want people to do really well and show me the best they've got. You know, and you do sometimes, even when you're asking the questions, like you say, sometimes you fumble it a bit and you're not sure. You know, your own words. So of course everybody's nervous. You know, the interviewer and the interviewee are both nervous, but I guess you both want to do well. So no harm, like you said, in just saying, can you just ask me that again because I'm not sure, or reframe it like you say.
Yeah. And then I suppose the other thing is, what do you do if you're unhappy in the role? So you get your first role, I think, and you see, I've had lots of questions about this. What do you do if you're unhappy in that first role? Like, can I just move, get another job? Is there a certain time frame that I need to stay? What would your advice be for that?
I would say there is no time frame. I think, again, like in the classic old school way, there was we'll just stick it out, just toughen up and just, you know, just ride it out. That's not the way we should be doing it. So we are losing so many nurses, really good nurses, that are leaving the profession completely because they've hit upon a really terrible work environment. And you don't have to stick with the first job you get. You don't have to stick with any job you get. That, again, one of the only bonuses for there being such a shortage around the country of nurses is you can go to many different places. So you may go somewhere and you think, this is not for me. Like, you may go to a secure service and think, I don't know, I don't really like the environment, I want to go community. Why not? You can move. You know, that's the thing I would say is don't suffer in silence. So if you're really, really unhappy somewhere, there's no problem in leaving. Absolutely not. And I think that's a big thing that we need to move on from is, I think, again, traditionally, nurses used to stay in places for long times and put up with stuff that they really shouldn't be put up with, you know, affecting their mental health, affecting their well-being, and then people burn out and then they leave the profession completely. And that's just such a waste, because there's so many very different aspects of nursing. You don't have to stick in the one place you're in. And like I said, there's no harm in moving after 6 months, 2 months. There's no set guidelines. Right?
No, that's such good advice, John, and I totally agree with you. I mean, the one thing I would add to that, I suppose, is just making sure that if you are finding it difficult, that sometimes newly registered nurses don't speak up or feel that they can't, or that the senior nurses are so busy they don't want to bother them. But always speaking up, talking to somebody, and then sometimes they can put you on more of a structured plan. They might be able to extend your supernumerary time. You know, there's different and obviously if nothing changes and you're, you know, unhappy, but sort of trying to get a bit of support sometimes helps as well, doesn't it, at the start?
Absolutely. I think that the issue is, so obviously when you're a newly qualified nurse, there is going to be stress, right? There's going to be a lot of anxiety, and it's going to be tough when you first start. But it's finding that line between what's tough and acceptable toughness and, you know, hard work, you know, just that normally, and what is beyond that, and what is like, I can't cope with this. This is not what I signed up for, you know, and finding that balance is tough. But you're right. You're absolutely right about talking up. I always admire the new nurses on my ward, because they're the ones who've done the research, like literally 2 months ago. You know, they're right at the forefront of what's being learned and what's being taught. So they can bring loads of stuff to the arena and to the ward. And I think sometimes older nurses get a bit stuck in their ways, and they get a bit like, well, this is the way we've always done it. And then a new nurse comes in and goes, oh, but we've been told not to do it like that. Absolutely, speak up. You know, I'd much prefer. And you know, sometimes it takes some explaining. So some new nurses will come in and go, why are you doing it like that? And if someone sits down and goes, well, actually, we do it because of this, then it gives them a, you know, then they can go, oh, right, now I understand. But if you're just seeing things being done a certain way and you're not sure why, and you're a bit confused by it, ask. Yeah, absolutely. And if the nurse, the qualified nurses and the managers are confident in what they're doing, they should be able to explain it to you. And never stop questioning. That would be a really good top tip, is always question where you are. And if you're not happy with the answer, you know, go higher, or like you say, make some noise. Don't be afraid to make noise.
That's brilliant. I mean, one thing I've just thought now you're talking is about evidence-based practice, and you're absolutely right. You're learning from students, aren't you? That, you know, because they've got all that up-to-date research. So what is there any areas you think are really good? If you've got somebody, you might get a question such as, what's the last thing you've read? How do you keep yourself up to date? Is there any areas that you think, you did mention one area actually, but any areas you think are good to look into if you get asked that sort of question as well?
Particularly mental health nursing, particularly, like obviously people can get bogged down in kind of medication and, you know, sectioning and things like that, but really therapy is where it's at. So talking therapies are really essential for what we do, and trying to learn about what's the latest kind of stuff going. So CBT was a big thing for a while, so it's really, really popular, but now we kind of evolved to, some people prefer DBT, and just finding out what them terms is. I'm not going to tell people, they're going to have to research. CBT and DBT are kind of used throughout mental health care, and find out what they are, why they're used, and like you said about the newly qualified nurses, is they'll learn about the most up-to-date kind of therapy that's working and being used, and the research about what therapy is helping. And so them coming into the workplace, I can learn from them, and they can tell me, like, well, actually this therapy really works well with patients with eating disorder, or this therapy works really well with, you know, patients that are depressed, you know, or in 95% of cases this works really well. You know, they've got the most up-to-date stuff, and I want to learn from them more than, you know, them learning from me.
I wish all managers were like you, John. Everybody's going to want to work for you now. So I think that's it, John. I think you've covered so many good tips and advice. Is there anything else you want to say at the end or anything? But
well, like I said to you at the start, I know it's like it's cliche, but you are interviewing, they're interviewing you, but you are interviewing them, and you're trying to find out, why do you want me for this workplace? Like I said, we're crying out for really good nurses and really professional, really enthusiastic, and really, you know, people that want to help. And I think it's sadly lacking at the minute. So you are wanted. That's what I would say to the students. They really want you.
Yeah. And the only other thing I suppose would be any questions to ask at the end of the interview. So, I mean, I've got a video on how some example questions about post-registration development or stuff like that. But any tips for sort of?
I'd say top tip: definitely ask a question. I know, again, this is another cliche, but if you don't ask any questions, it does make it seem like you're not that interested. You know what I mean?
Yeah.
Even if you've just got some bog standard generic question, please ask something, because then it keeps the interaction going, and it shows that this student wants to learn about where this place is. Questions you could ask: how much money are we talking? No, don't ask that. Don't ask that. Hopefully that'll be listed. Hopefully that'll be listed on the, you know, thing. You don't have to worry about money. But a good one to ask would be like, you know, as you said, what provisions do you provide for staff for stress and things like that? And how do you help staff that are struggling and things like that? That's a good one to ask. Or another thing you could ask, like you said, is how do I develop? So I'm going to be a new nurse. Do you have a preceptor program? Find out what preceptor means and things like that. How long do I get in my preceptorship? What's my route to nurse, senior nurse, deputy manager? You know, what's that kind of route? And so that's a really good one to ask. And like you can ask, you know, I would ask something. That another again, as I said, my top tip would be ask something. It doesn't matter what it is, but ask something. Ask a question, even something as silly like, you know, we have people ask, do you wear a uniform and things like that. I know it sounds silly, but that's a really good thing to ask, because you're going to turn up on your first day, and if you don't know if you're wearing a uniform or not, or what is the uniform, then you know, in a lot of mental health settings we don't wear uniforms, right? So it's good to know whether you do or you don't. Is
there some mental health settings that do wear uniforms then?
Yes, so some will have like, they'll have like what's it called? polo tops or whatever, you know, different coloured polo
Oh
tops.
yeah.
I'm not really a big fan of the whole
Yeah.
great, like dark blue senior nurse, light blue. All these,
I know,
like you can
yeah.
tell whereabouts someone is on the rung depending on the colour of their t-shirt. But anyway,
Yeah,
but that kind
yeah.
of thing, you know, I know it sounds silly, trivial, but you know, it's a question to ask because you're going to have to know.
Yeah, absolutely. Yeah, so that's brilliant. So thank you so much for all your top tips. I'm sure they'll be so helpful for students or newly registered or early career nurses. You've come up with some brilliant tips. And I know you mentioned that we might do something together on the transit, because I'm not a mental health nurse. This isn't brilliant for, you know, because you've got that sort of specialised knowledge, but something on transition. But we'll see what people want. I'll maybe put out a community message and see, but something on the transition, because as you sort of said today about that jump when you first start as well can be quite sort of a big thing, and we'll see if people want something on that transition and some tips with transition if you're still okay to do it. But
absolutely, yeah, like I said, there's because you know, we start as nurses, then we move up the ladder, hopefully, you know, to kind of deputy manager or band 6, maybe, as you call them, and that's a slightly different interview, and it'll be a lot, you know, kind of different questions to when you first start.
Yeah, brilliant. Okay, well, thank you ever so much, John, for your time today.
Thank you.
Okay, thank you.